All right, well, it's 3:30. Thank you all for joining the main presentation and the breakout sessions today. Um, just wanted to do a quick recap of our breakouts for those of you that may have been interested in the alternate topic. With me today, I have Katie Gelfillan, who's our Policy Director of Physician and Clinical Practice, and Chuck Alsdorf, our Policy Director for Operational Initiatives. Lucy will be summarizing, Katie will be summarizing Lucy's session, and Chuck will be summarizing Leah's session. So, Katie, would you like to say a few words?
Sure. So you want me to get started on the recap? Yes, I'm ready to go. Let me just pull up my slide notes and have them in front of me. So yeah, we had a small breakout. Lucy and I led a discussion on telehealth, and certainly that's top of mind for many organizations right now, thinking about how telehealth has definitely ramped up during this time. I think they saw, in general, clinic visits dropped by 60%, telehealth ramped up. And so moving forward, as we kind of get beyond COVID-19, we wanted to have a discussion about how organizations are thinking about their telehealth strategy moving forward, and what do they need to keep top of mind, what do they need to be monitoring, measuring in order to have a successful financial telehealth strategy moving forward. So we first talked about how telehealth fits into the clinical mission of the organization. So thinking through different types of visit types that you have. So it could be modality. So audio versus audio visual. What kind of platform are you using? Are you getting it out to your patients, and are they able to access the visits appropriately? Thinking about the different specialties that have been utilizing telehealth. So certainly primary care and anything behavioral health. So psychiatry has been a specialty that many systems have seen a lot of telehealth growth in. Beyond that, some cardiology, pulmonology, OB, those patients that perhaps need high touch, telehealth has really fit into the management of them. Lower usage among perhaps, pediatrics or those specialties where an in-person visit is more appropriate. Thinking through what physician preferences are. So some physicians have really embraced it because they like the work-life balance, being able to connect with their patients if they're at home or even if they're in the office, but not having to bring patients in. And then certain other physicians would prefer to have inpatient visits. So it certainly also depends on physician preferences. Technology platforms, the ability to integrate the telehealth platform into the EMR is something that's important, and whether or not you're able to successfully, deliver telehealth. And then care management. So really using the full care management team to support both the clinician and the patient throughout the process. And then we talked about, really how do you build the operational support structure? So if you have a care management team, what is patient access doing? Are they, is there someone who's able to make sure that the patient is up and ready to go when the clinician is ready to see the patient? Who's triaging that patient to make sure that if it's a telehealth visit, is that appropriate, or should it be an in-person visit? So kind of looking at the staff that you have, maybe repurposing them, or really maximizing staff talent and resources to support a telehealth environment. Certainly workflows have changed, appointments are changing, templates are changing for, is the physician becoming more productive? I think that's an opportunity. Physicians may be able to see more patients than they have in the past, just given you don't have to have the room set up and things like that. And then really engaging patients and outreach. I know some systems have relayed that, they spend a lot of time, contacting those more vulnerable populations and making sure that they're engaged and they know that telehealth visit is an opportunity. So then Lucy shared, and actually I'm going to share this into the chat because she does have an article on this. So if you haven't seen it. It was published in I believe HFM. So I'm going to paste it really quickly. So talking about how do you build your financial model. And so she has a nice chart that I believe is in that article I just shared. What metrics should you be looking at? What types of visits and services are you doing? And then thinking about your reimbursement rates. How are you getting paid for this? And are you renegotiating your contracts with payers? This might be a good opportunity to look at your payer contracts and see how telehealth is covered. We talked about that some providers are now more likely perhaps to go into population health models or capitation, just given that, you know, their patients are now getting used to this, patients are now demanding it, and maybe they're better able to manage care at lower cost, you know, in the future. So things to think about, you know, how are you engaging with your payers, and do your contracts need to be renegotiated? Certainly you should be looking at your revenue and cost to deliver this service. And so, you know, take a look at that article. I think you'll, you know, see some metrics that are important for organizations to start tracking if they aren't already. And then really, how are you providing value? So the physician, you know, or the clinician, it likes it because of work-life balance. Certainly, you know, looking at compensations and incentive payments for the physician, looking at their productivity. Patients, you know, patients are getting used to it. It's a patient satisfier. Are you measuring patient satisfaction based on telehealth visits? I was talking to a provider last week who said that medication adherence has become much better for their patients because they've been doing more telehealth and checking in on patients a little more. So patient outcomes may improve, you know, just with the higher touch opportunities that, you know, you have with telehealth. Then looking at value-based care, satisfaction scores, quality scores, coding and risk scores, you know, getting patients in for the annual wellness visits, and then looking at care management, and then you know, again, like I said, payer contracting, patient outcomes, things like that, all becoming very important. So that was our discussion in summary.
Thank you so much, Katie. I really appreciate that. Chuck, would you like to go next?
Yeah, sure. So you know, we talked about, well, Leah led a great presentation on how WVU Medicine is utilizing the MAP app. WVU Medicine is 12 hospitals. They have 11 integrated on the Epic platform, and went through a virtual CBO realignment as well back in early 2019. And so that kind of changed their needs in some ways, and they felt like with the CFOs really being their clients, they were getting a lot of questions around how do you compare to other hospitals, how are you setting your targets and things like that. And they felt that while the Epic tool day to day is good and it's a great management tool, that it didn't provide that external benchmark, and it didn't necessarily provide the data that they needed to have that conversation with the CFOs or the system CFO. And so they really have it set up, you know, very specifically for their organization, having different views based on the type of facility or the groupings within the facility, and have set the benchmarks now that were agreed upon the CFO groups along with the peer group. So they, you know, they feel good about it. It's providing them the information they need to really communicate with the CFO, and it provides a visibility to metrics that not only, again, improves that communication with the CFOs, but also just shines some light on performance. And so she acknowledged that, you know, the performance has improved in some areas because there's a brighter light on these metrics, and how you're performing against peer organizations. So I think it was a great presentation. There's a lot of discussion around kind of how you're using different things. But Leah, if I missed anything, please jump in. But I think that's kind of the fundamental discussion we had about the, you know, really the value of MAP app and how it provides something that is complementary to what Epic provides from a kind of a more of an operational perspective.
It was a great session, and thank you for recapping that, Chuck. All right. So we've created an evaluation for this session because, as I said, it is our first virtual user group meeting. And our thought is that we would like to continue to leverage this technology to potentially more frequently, potentially on a quarterly basis or a monthly basis, to have more discussion groups and create more of a community amongst subscribers. And we could certainly look at things like assembling with some planning, assembling those with the same patient accounting system, those that are the same, a similar hospital type, like teachings or critical accesses, to help you connect more with peers that are like you. Erica is going to paste this evaluation link into the chat box so that you can all respond now, and understanding that not all people might be back in this closing session, we will be emailing this out as well to capture everybody's feedback. I would like to thank everybody who has contributed to this event. I never imagined it would be more complex than a physical in-person presentation. There are just a lot of different pieces and parts that have to come into play when you're dealing with a technology platform. But I'd like to thank Lucy Zelensky from Lumina Health Partners for presenting, for being so generous with her time and expertise on telehealth. I'd like to thank Leah Klinke for sharing her experiences with MapApp. She's been on about a year now, and I remember doing all of the customization for her group, and I really admired all of the thought and the consideration that went into creating all of her viewpoints and the reports for the different team members to make sure that everybody was using the tool in the same way. I'm happy to do this. If you're interested, if your organization is interested in doing more customization for your users, please don't hesitate to reach out and contact me, and I can take you through some options, whether it's just a few settings or whether you'd like more than that. We can definitely talk about what will be meaningful to your organization. But as we say here at HFMA, it takes a village, and I really just would like to give my most sincere thanks to Erica and the entire HFMA chapter relations team. They helped to run this meeting today. I never could have done this on my own. Chuck and Katie and Todd are all in our healthcare finance policy group, and I look to them daily, usually many times a day, for their expertise and guidance. I really appreciate it. Jen Vandenberg for helping to support us in the telehealth session. Kayla, my colleague, who helps me in so many different ways with onboarding. And of course, my boss, Joyce Samalski, for her partnership and leadership for this tool and the support of building MapApp 2.0. So as I said, please don't hesitate to fill out the evaluation. I would like to make a quick plug for our HFMA Revenue Cycle Conference, which takes, if you haven't already signed up for it, it takes place, I think it's Wednesday and Friday, I believe, September 30th and October 2nd. And you can register by going to the hfma.org website and clicking on the events menu option in the top bar, and you'll see right there, you can, once you go to the conference, you can register on that page. And please know that MapApp subscribers receive special discounted pricing. So what you see on the screen is not the price that you would pay. Please do contact me if you would like more information about the benefit that you get as a MapApp subscriber to attend that conference. And again, thank you everybody for attending today. We're ending a little bit early, but I'm guessing that it's okay to give you back about 15 minutes in your day, as I'm sure there are a lot of other things you'd like to tackle today. So thank you again, and I look forward to talking to you on the phone the next time we meet. Talk to you later.